Test, test. Whoa.
The April 30th, 2024 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Blankley. Mr. Blankley is present. Ms. Bonnick. Ms. Bonnick is present. Mr. Brew. Mr. Brew is present. Mr. Cruz. Mr. Cruz is present. Mr. Dondorfer. Mr. Dondorfer is present. Chairwoman Hasman. Chairwoman Hasman is present. Mr. Milne. Mr. Milne is present. Ms. Smith. Ms. Smith is present. Ms. Vasquez Simmons. Ms. Vasquez Simmons is present.
Is there anyone signed up for the public forum?
There is not.
Is there anyone present who has not signed up to speak who would like to address the committee at this time? All right. The next item on the agenda is the approval of minutes. You have the March 26, 2024 minutes before you. They will stand approved unless the clerk is notified by any changes by the end of the day. Next item on the agenda is new business. Mr. Clerk.
Referral 24-0122, acceptance of a grant from the New York State Office of Mental Health for the PFC Dwyer Veteran Peer-to-Peer Support Program and authorize a contract with Compeer, Inc.
Moved by Legislator Vasquez Simmons, seconded by Legislator Blankley. Is there any discussion? Yes, Mr. Milne, Legislator Milne.
Yes, Madam Chairperson, through you to the administration. So I see we have a grant of $185,000, and we will be working with Compeer Incorporated for $170,000 to pay them to facilitate this. Wondering what will be done with the remaining $15,000 of the contract.
Through you, Madam Chair, it reimburses us for our own staff time for that.
Perfect. Thank you very much. And through the chair to the administration, wondering if there were any other respondents besides Compeer for the RFP.
Through you, Madam Chair, Mr. Stefanovic is not here. I think there might have been confusion about the time. If we can get back to you with that answer before full legislature.
Absolutely. Thank you very much. And I yield the floor.
One more thing through you, Madam Chair. I had texted him. I see that this is on the agenda through Ways and Means. So I would expect we should be able to get an answer to that tonight. I apologize.
No, not at all. Thank you very much. I yield the floor.
Further discussion? All those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 24-0123, acceptance of a grant from the National Association of County and City Health Officials for the Medical Reserve Corps Capacity Building Program entitled Medical Reserve Corps Operational Readiness Award.
Moved by Legislator Vasquez Simmons, seconded by Legislator Blankley. Any discussion? Yes, Legislator Smith.
Through the chair to the administration, can you let us know how often these classes are taught?
Through the chair, this is Mike Sayers from the Department of Public Health. The classes vary approximately 6 to 8 times a year. We visit different colleges, nursing schools. We also reach out to NTID. We've done some classes just in January and April within NTID, Center for Disability Rights. So 6 to 8 times a year, we conduct these classes.
Thank you. Through the chair to the administration, what is the reasoning behind the decrease in the funding this year?
Through the chair, the decrease in the funding is based on the funding that has been authorized by the federal government through the CDC.
Thank you. I yield the floor.
Further discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 24-0124, acceptance of a grant from Health Research for the Expanded Partner Services Initiative.
By Legislator Vasquez Simmons, seconded by Legislator Bonnick. Any discussion? Yes, Legislator Dondorfer.
Thank you, Madam Chairwoman. Through you to the administration, what is an out of care patient and how will they be identified?
Madam Chair, before we answer that question, if I may, if I could go back to legislator Milne's question, Compeer was the only respondent to that RFP. Thank you.
Thank you very much, sir.
Through the chair, an out-of-care patient is defined as somebody who has not had a reported lab test done for 13 to 24 months. That's how they're identified through the electronic lab reporting system.
Thank you. I yield the floor.
Further discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item?
Referral 24-0125, acceptance of a grant from Health Research for the Medical Reserve Corps, state, territory, and tribal nations representative organizations for Next Generation Program.
Moved by legislator Vasquez Simmons, seconded by legislator Bonnet. Any discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Are there any other matters to come before this committee? There being no other matters, the April 30th, 2024 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, May 21st, 2024 at 5